Good morning, everyone. Dr. Dempsey here, on call with Doc Dave. And this is episode number 30. Today we're going to be talking about pediatric illnesses / SIDS. So, first thing I want to talk about is pediatric illnesses, and then we're going to go into the SIDS, the SIDS, Sudden Infant Death Syndrome. So, pediatric illnesses, the most common is the common cold. It's a rhinovirus, it's contagious, they get stuffy nose, sore throat, low-grade fever, cough, usually resolves in a matter of about a week. But that's pretty routine on children between 1 and 5 years of age. The second one is the dreaded ear infections. Children get a little fever, runny nose, start pulling, tugging, poking at their ear, and that's either a bacterial or a viral infection. So those sometimes, as a rule, need to be treated with an antibiotic because if it is bacterial, it's not going to clear without some relatively aggressive treatment. The next is influenza, the flu. It's a virus, it's contagious, and it's prevented by vaccines, the flu vaccine. And I believe it's children from the age of 1 year and older that can receive the vaccine. Next is bronchitis. You get coughing, fatigue, headaches, fevers, sore throat. Thing you got to worry about this is that it doesn't progress to a pneumonia, because as we've talked before, bronchitis is an upper airway infection. Pneumonia is a lower airway infection, but the bronchitis can lead to a pneumonia. So you got to be careful if the fever gets really high, 103, 105, kid looks bad, getting dehydrated, a spasmodic cough, you got to get them seen, either by the private pediatrician or into the emergency room. Next one is RSV, respiratory syncytial virus, and it's a cold with symptoms of fever, nasal congestion, but the thing, again, you got to be worried about this one, just like the bronchitis, is that it can lead to pneumonia. So, it's common sense stuff. If the kid doesn't look good, it's not getting better after 3 days, the cough's getting worse, temperature's 103, you got to get them looked at, and probably they're going to need to eventually be put on antibiotics. The RSV is confirmed by a nasal swab, which can be done and get the results back immediately. Then there's something called a hand, foot, and mouth disorder, which is a contagious disorder. It's a rash that they get, and you start getting splotchy, contagious lesions in the foot, in the hands, and then if you look into their mouth, they have it there as well. Like I say, it's a virus, and it will resolve spontaneously. Conjunctivitis, the dreaded pink eye, especially in preschool and care centers that you drop your children off at, and even into kindergarten. If they're in a setting like that and one of the kids gets it, you have to keep that kid at home away from the school for 3 days till it resolves, and if you don't, it'll spread like wildfire through the center where the children are. So be careful because, they rub their eyes with their hands, the hand gets contaminated, they're playing with a ball or something, and it spreads to somebody else. Now, the interesting thing about pink eye is usually it starts in one eye and you think, oh, okay, and if you got antibiotic eye drops or you're treating it, you generally want to just treat that eye. But you got to treat both eyes because they will rub their eyes and they will spread it from one eye to the other. So you're just going to be chasing it back and forth if you're just treating one eye. So when you get antibiotic drops, if they're necessary, then you need to use them in both eyes, even if one of the eyes doesn't appear to be infected. Gastroenteritis. Okay, stomach flu is what we used to call this. It's a virus, nausea, vomiting, diarrhea. The big thing about this, even though it resolves spontaneously and generally only in 1 day, 24 hours, sometimes 2 days, is kids can get dehydrated really fast. So they don't have the body fat, they don't have the body weight, and if they start vomiting or having diarrhea, you got to be really on top of this. And the best supplement for this is Pedialyte, and it's very effective. And you just monitor how many times they're urinating to monitor how often do you need to give the Pedialyte. Should be urinating about every 2 to 3 hours. Now, the next one is sinusitis. It's a sinus infection, increased fluids in the sinuses, bacterial infection, sometimes virus. But if you got a fever, especially if the face is starting to get a little red or maybe a little swollen around the sinuses, you got to treat it pretty aggressively with antibiotics. Next one is strep throat. Now, it's kind of hard to determine, especially for a layperson, whether it's strep or a virus or whatever. If you look into the back of the throat, a lot of times with the strep throat, you'll see a grayish, whitish plaque over the tonsils. But it is a bacteria, so you generally got to go in, get a swab on the tonsils. If it's come back positive for strep, they'll put you on an antibiotic. Usually you have associated swollen glands in the neck area and in the tonsils. The tonsils are going to get pretty big and swollen. You got to be careful they don't get an abscess in the tonsil. That's why you got to get it tested. If it is strep, you got to treat it. So the next disorder is chickenpox. Now, they do have vaccines now for them, the Verivax vaccine. And that will prevent chickenpox just like the flu prevents the flu and the COVID prevents the COVID, as a rule. Not 100%, but if they get the chickenpox, then they're immune to it for life. The only problem is you get the chickenpox, you can get cold sores in your lips as an adult. You can get herpetic infections that will arise from immune deficiencies or stress. So chickenpox, we all got them as a kid when I was a kid, last 3 or 4 days, and then that's all you need to do. Now, other disorders that you got to be aware of is croup. You're going to have a kid that goes to bed at night, he's looking good, he's feeling good, maybe a little runny nose. And then at 1 o'clock in the morning, like an alarm clock, they start in with the croupy cough. And it's like a barking cough. I mean, you're going to say, gee, I didn't know we had a dog. But it's pretty like a dog bark. And there's some home remedies you can do for this. You don't really have to run to the ED, although it's pretty dramatic. So you're going to, you may want to go just to get it looked at, make sure it's nothing else. But if you decide to stay at home and treat this, the best thing is take the kid, go sit out on the porch on a nice, moist, foggy night in San Francisco. Let that humidity get into their lungs, that mist, and that will clear them right up. Keep them hydrated, maybe a little Motrin if there's any fever. But if you're concerned or it doesn't get better with that, go to the ER. They can give them humidified mist treatments and hydrate them up a little bit. And check in the tonsillar area to make sure there's not a strep or a abscess developing. Sometimes you can even get a X-ray of the neck. It's called a lateral X-ray of the neck, and it'll look to see if there is anything called an epiglottitis. We won't go into that right now, but that's pretty dangerous if it is, because it can shut off the airway. So if the child isn't getting better at home with conservative treatment, take them to the ER middle of the night and get them looked at, get them treated, make sure they don't have anything more serious. The other disorders are diphtheria, pertussis, and tetanus, which are all treated by the DPT vaccination. The measles, mumps, and rubella, which are all treated with the MMR vaccination. So there are a lot of things you can do to prevent these disorders. So you don't wait till you get them and then try to treat them. You try to be proactive with the vaccinations, and that will eliminate a lot of the pediatric childhood illnesses. So the next question is, okay, now that you know most, if not all, of the common disorders, is when do you call a pediatrician or when do you go to an ER? Now, the main thing is if they have a history of comorbidity disorders, meaning associated long-term chronic disorders like juvenile diabetes, where they're insulin dependent. They get sick, they can get sick really fast. So in other words, they pick up a little respiratory disorder that you think's not much, and it can accelerate to glucose disorders, hyperglycemia, diabetic ketoacidosis, type things. The other one is asthma. If they have asthma and they get an upper respiratory infection or a disorder or bronchitis, that can accelerate the asthma and get a pretty significant asthma attack that doesn't respond to your rescue inhaler. So you have to take them to the ER. And of course, if they have immune disorders, leukemia, anything like that, they don't generally have the response from the immune system to fight off the infection. So you may have to take them to the ER and get them, or notify their pediatrician and get them looked at. Now, the other things to contact a pediatrician if they got signs of dehydration. If they've had nausea, vomiting, or diarrhea over 2 to 3 days and you're trying to keep up with the Pedialyte, it's kind of hard because, they don't want to drink, and if they drink it, they throw it up right away again. So if they look like they're getting dehydrated, listless, sunken eyeballs, dry skin, dry mouth, dry tongue, get them into the ED or call their pediatrician and get them hydrated. Usually you have to go to the ED and get an IV started and give them a fluid replacement. If the fever is greater than 103, you probably should notify the pediatrician. If it's 101, 101.5, even 102, you can generally treat that with, Motrin, Tylenol, hydration, take the clothes off, keep them, from getting overheated, and that'll usually resolve. But if the temp's 103, 103.5, you might want to get them looked at. And the last one would be respiratory distress. Even if they don't have asthma, if they look like they're getting labored respirations, big retractions, starting to get fatigued, respiratory rates over 40, kids just not looking good, get them to the ER, and they'll notify the pediatrician from there. So the next topic is 5 leading causes of death in children. I know it's not something you like to hear or talk about, but it's something you need to know. The most common cause is birth defects, unfortunately, congenital deformities. Next most common cause is accidents, motor vehicle accidents, falls, falling off bikes, getting hit by a car. Next one is pneumonia. Now, other than accidents and birth defects, which you can generally prevent, by, instructing children and keeping a close eye on them, pneumonia is the number one death in pediatric age. Cancer, leukemias, mainly, and meningitis. Got to watch for that. Kid has a seizure, he's got a high fever, he's got a rash, got petechiae, which are little red dots on his face and stuff. Yeah, you got to get him to the ER, 911. And also if they're premature with a low birth rate, and low birth rate is anything under 5 pounds. So if they're if they have, if they're delivered at 32 weeks and they got a 4.5 pound birth weight, these kids are more susceptible to infections and more susceptible to early death. So let's talk now about SIDS. We don't seem to hear so much about it now as we used to, but if it happens to anybody related to your family or friends or office workers or anything, it's just a disastrous history and presentation. So you need to know about SIDS, especially if you are planning on having children or have children that are under a year of age. This is going to be very informative and educational for you. So the definition of SIDS, it's an unexplained death of infants less than 1 year old during sleep. And that's what it's called, sudden infant death syndrome. Causes are unknown, unfortunately. It's not necessarily a virus, it's not an infection, but there are certain things that you can predict that maybe will lead to SIDS, or you got to keep an eye aware on your child that's a potential problem for them. So, what are some of the causes? Well, problems with the ability of the baby to arouse from sleep and detect that they have a low oxygen level and increasing CO2. So what does that statement mean? Well, if the child's sleeping on his stomach and he's got his face on the mattress or into a cover around him or a blanket, he's not going to get as much oxygen as he should be because his face is covered up. And he's going to start retaining CO2, because that's how you get rid of CO2 is you expel it through your respiratory system. And kids that are susceptible to SIDS, they don't have the ability for some reason or another to arouse and roll over or whatever else is needed to start increasing the oxygen supply and decreasing the CO2 levels. The age is usually 1 to 4 months, although it can go up to 1 year, and it's usually in cold weather environments, and especially if the mother has smoked during pregnancy. They're saying now that there's a tie to that. And again, low birth weights, less than 5.5 pounds, or premature. So those are all the children that you got to be aware of that may be a statistic for SIDS. Now, how do you prevent SIDS? Okay, always place the baby on their back to go to sleep. You don't put them on their stomach, you don't put them on their side. You should always have your baby on their back. And they should have a firm, flat, waterproof mattress. They should keep their head uncovered. You could put a little, skull cap on them, but don't be putting anything around their face that may obstruct their ability to breathe. If you have a child that has a potential for SIDS, which I had mentioned earlier, just a minute ago, the probabilities of having SIDS, you want to have that child sleep in the same room with the mother up until they're at least 4 months of age. So if you got a low birth weight kid, or maybe there's some congenital deficits, and they're in that 1 to 4 year month range, or if you want to just be super cautious with your baby, it's always a good idea to have the baby sleeping in the room with the mother up until maybe even 6 months of age. There's no smoking in the house. Nobody comes over the house to smoke. You just have to really eliminate that. Give the baby a pacifier when they go down for their naps, because it stimulates their respiratory system and makes them breathe more effectively. And breastfeed the babies. They're showing that the antibiotics you get from breastfeeding and the nutritions that you get from breastfeeding are a preventative mechanism for SIDS. So, that's pretty much it. Now we know about pediatric illnesses, common stuff, not so common stuff. When do you call the pediatrician? How do you treat them at home? When you call your doctor? When you take them to the emergency room? And we know about SIDS, what we can know about SIDS. Not a lot of people know everything about SIDS, but we know enough that you can heighten the awareness if you have a child that may be a candidate, unfortunately, for SIDS. So hopefully this was, informative and educational. Pass this along, share it with any friends that are pregnant or thinking getting pregnant or have a child in that age range from 1 month to 6 months. I think it's well worth listening to this episode because, 15 minutes, we concised a lot of stuff that would take you hours, if not longer, to find on the internet, and it would be more confusing. So hopefully you like this. Hit the like button. Please subscribe. I like subscribers. And we'll get another episode up real soon. And thank you for your time and have a good day.